one towel here. Then
It's
I
for
need,
bed bath.
guys, I need two basin, right? One basin is with the water only, and one basin is with the soap and water. Okay? Make sure that the water is warm. Okay? So for example, this is the water, and this is water with soap. So we'll put it. Okay, how we will check if the water is okay, warm? How will
Just check with
it?
your
We can
hand.
use this one inside the wrist, okay, if it's okay. Or we can use our elbow. Why? What's the reason why we are using this and this? Why I will not use this?
This is clean.
Very sensitive to heat. Okay, our nerves is very sensitive here because they are more particular here, more present here.
The nerves.
Okay, now, for example, we have this. If you can bring next Friday, small towel, yeah. Okay, so you know the meat, no? How to put a meat. How to do the meat. Meat. Okay, because it's so big.
Yeah, hindi ma-fold, ma'am.
No problem. Okay, what we are going to do, okay, for the face or especially for the eyes, what we always remember that we should clean from cleanest to
the
dirtiest. So if we are cleaning the eyes, we should start from inner to outer canthus. Inner to outer canthus using different section of the cloth. Okay? Then we should always remember that we are always using the wash, rinse, dry principle, except for the eyes. Okay, don't put soap in the eyes. Okay, only we are using, that's why it's there, rinse and dry only. Understood?
Yes,
okay.
ma'am.
So, we make a mitt like this, okay, like this, then put it inside. Okay? Then, we should rinse it with water,
and
okay,
soap.
by
What?
using different section of the cloth. Then here,
Inner and outside.
then we should
Dry.
dry it. Okay? Always remember, if you rinse, if you wash, rinse, always dry it. What's the rationale? What's the reason why you're drying it immediately?
So that the patient will not get cold, ma'am?
Yes, hypothermia. To prevent hypothermia. Then, now we will do the wash, rinse, dry. Face.
Okay.
Okay. Then, ears. Under the ears. Back of the ears, I mean. And
The
then,
neck.
the neck. This is wash. Then, you rinse.
Excuse me.
You rinse. Okay. Then,
Dry again.
okay. You use different towels, huh?
Yes,
This
ma'am,
is
clean
wash,
and,
this is for rinse. Okay, but we have only one. This is very big. I cannot use it. Then, after the face, after we did the faces, we'll do the
Arms?
no
What, ma'am?
shaving.
Shaving pala.
Okay. So what are the things we need to remember if we are shaving? We should shave towards the hair growth. For example, the hair growth is going like this, so how we will shave? It should be toward or against?
Towards.
If the hair growth is like this, so how we will shave?
Like that.
Like this also. Understood?
Okay.
If the hair growth is like this, so how we will shave? Like this. Understood?
Yes,
but
ma'am.
other books will tell you against.
Yes, ma'am,
Okay, but we
against.
will follow the standard one.
For
so
the-
it should be towards, like this.
Okay. Towards.
Okay, it should be towards. So what are the things we need to remember as well? If you have cut the face of the patient or the skin of the patient, what are going to do? Press it. Put pressure. Anything bleeding, any bleeding, you can put pressure to stop the
Bleeding.
Okay? Then, first is put the towel on the warm water, okay, to rinse, okay, and to moisten the face to be shaved. Okay, this is applicable only for male
Men.
patient. Okay, but some patients you will do shaving. Who are those patients? If you will do a certain surgery, for example, they will operate the head. Okay,
Mm.
you need to shave the head, and it will take a long time. So you need to do it in advance. Okay, you need to remove any part that has hair. Okay, that will do any surgery. You need to shave it. You need to remove the hair. Why? The reason is it will cause infection. It will cause infection. Okay? So you need to remove it. So you need to moist it 5 to 10 minutes. Then ask the patient that we can put something. Okay?
The shave cream.
Okay, shaving cream. If the patient, make sure that the patient is not allergic,
Allergic.
to that. Okay, then shave towards the hair
hair.
growth. Okay, open this. What is better, electric shaver or the disposable shaver?
Electric.
Electric shaver.
ma'am.
Always prefer the electric shaver. Why? Because this one, the sharp one is more controlled than the other one. Most of the patient, if you will give disposable shaver, you will see there is
Cuts.
bleeding or
There's
cut.
always a cut.
Okay, so just shave towards the hair growth. Okay, then rinse it with water. Then, okay, and then this one. But you should ask the patient before shaving, because some patients they prefer the
Someone likes the mustache.
yeah, and their culture, no. Okay, so you rinse it. Okay, if the patient wants after shave, and if the patient is not allergic to that, you can put after shave or lotion. Okay, moisturizer. Then remove it, and everything is fine. Any questions?